3 I'm gonna say is mandatory, and if you take nothing else from this video, take tip number 3, run with it, put it in your pocket, lock it, and throw away the key. Don't throw away the key because you need to use it, but you get the point. Just take the tip, okay? So moving on to tip number 3. Hi friends, Jaimee Deon here, and welcome back to my channel. So today is another nursing video, okay? Your nurse bae Jay is here to drop jewels on you, to drop gems on you. I'm here to shed some light, okay? I'll be telling you how I passed my Nclex the very first try in 75 questions, and I'll be giving you some tips and tricks on how you can be successful as well. So if this is something you're interested in, then just keep watching. And before we go any further, go ahead and click that like button because you're gonna like the content, okay? I'm giving you everything that I used, and if you use these tips exactly the way I'm telling you to use it, you're going to be successful. Second of all, I need you to subscribe, okay? The content is coming, so go ahead and click that subscribe button, join the family, and then just go ahead and leave me a comment. Let me know what you think, and without further ado, let's go. So before I jump into the tips, I'm just going to give you a little background information on what the Nclex is. This is just in case I have any nurse baes who are looking to go into nursing school, or I have some that are just starting nursing school that aren't really familiar with what exactly it is. So the Nclex is basically your board exam. Once you graduate nursing school, you are a nurse, but it's not until you take and pass your Nclex is when you become a registered nurse. So it's basically the most important test of your nursing career. I mean, that's just what it is. I'm not going to sugarcoat it. I'm not going to dress it up and make it real. I'm just going to give it to you straight. So it is a very important test. I know for me in nursing school, it was a very dreaded test because it's like, okay, I've worked so hard to graduate. I'm finally here. And then it's like, but it's not over. It's not over. You still have one more obstacle, but that's why y'all have me. I'm here to make this obstacle a little less difficult, okay? I know when I was ready to take my Nclex, I researched videos like this, and I just couldn't really find one that I felt like gave me the tips that I needed. So I'm gonna do my very best to provide that for you all. And then if you have any additional questions, please feel free to leave them down in the comments. I'll also leave my Instagram name up here if you guys want to shoot a DM. I'm here to help, so whatever you need. But that's a long enough intro. So the very first tip I have for you, it may sound like a no-brainer to some, but I'm still going to share it because in my opinion it is the most important tip, and that tip is to have a great foundation in nursing. So what I'm saying is, while you're in nursing school, just make sure you're taking full advantage of your professors, of your classmates. Make sure that when you're going over your notes, that you're not going over the notes to pass a test. You're going over your notes to learn the information so that you can one day put all of this into practice and take the best care of your patients that you can. So I feel like in nursing school, you just have so much on your plate to where you can almost feel like you're cramming for certain exams and tests. And not cramming in a way to where you're studying at the very last minute. It's just to where you have so much on your plate at one time to where you're just having to learn a large amount of information in a short amount of time. And if you're in nursing school or you've been through nursing school, then you know this to be true. But what I'm going to tell you is, do not memorize information. You have to learn it, okay? You need to know what it is. You need to know what causes it. You need to know the side effects of it. You need to know why it's important, okay? Don't just learn lab values. Know, okay, the sodium's low, so the patient is going to have this kind of side effect, or the sodium's high, they'll have this type of side effect, and why it's important. So not only learn your what's, learn your whys, and learn why it's important and why you're learning it. So like I said, that may sound like a no-brainer to some, but it's just so important because you can just find yourself with a lot of information, but you don't necessarily know how to put it into practice in the clinical setting. So moving on to tip number 2, this is actually going to be the first resource that I mentioned, and I have it here with me. Let me just show you. This is my Hearst booklet, okay? Gym, major key. So the Hearst course that we chose was a 3-day live lecture. We had professors from all over come and teach us different sections of different body systems. So we had one person teach cardiac, another teach the neuro system, another teach psych, and so on and so forth. And what I like about this manual is that it is very easy to read and you follow along with it and you fill in blanks. So it was very interactive. What I love about this is this booklet that I'm showing you literally has a ton of fill in the blank lines. I don't know if y'all can see this. If you can't, I'll put another clip on here showing it. But as the person is giving the lecture, you're literally listening and filling in the blanks. So I really love that about it. It basically hits all the high points of the systems, puts it together in one binder. So once you fill everything out, what I like is that you have it to keep. You can study it over and over as much as you like. You can go over the lecture again. Also something with hers, after they do the live lecture, they also offer online to where you can watch, where you can have the lectures basically at your fingertips. So that was great as well. And it also came with some practice quizzes and questions to where you can quiz yourself and really see if you're understanding the knowledge like you want to. So this for me was very helpful because, like I said, it's hitting all the high points, all the important things about each system, and it just has it in this easy to read manual that you have for life. So even after I took the course, I read over this manual over and over and over again until I was blue in the face, literally. And it was so helpful. And they, like I said, they also have the videos. You can watch the videos as many times as you want. The practice questions were amazing to test and gauge your knowledge. It was just a really helpful resource for me. I just looked up the price and it is a pretty penny. So as you know, when you have a big group of people doing something like a review or whatever the case may be, you kind of get a discounted price. So when I had to do the review, because my entire class was doing it, my price wasn't as expensive, but looking up the price, it's not cheap. So the course that I just told you about, the Hearst Live, actually retails for $3.99. Yeah, I know. And that includes 3 days live in the classroom, 9 months access to specialty lectures, a Hearst Q Bank, and 4 readiness exams. And they also offer payment plans. Now, $3.99 is a lot of money. I understand that. I am not ignorant of that at all. And I know when I was in nursing school, I had no money, okay? I was broke as a joke. So if that is out of your reach, do not worry, do not fret. I won't sit here and tell you that this is absolutely positively mandatory, because that's simply not true. It is a helpful resource. It is a great resource to use if it's something that you can afford. If not, don't fret, okay? Your good sis got you for tip number 3. Tip number 3, I'm gonna say, is mandatory, and if you take nothing else from this video, take tip number 3, run with it, put it in your pocket, lock it, and throw away the key. Don't throw away the key because you need to use it. But you get the point. Just take the tip, okay? So moving on to tip number 3. So tip number 3 is actually an app that you can have on your phone. I know, right? So innovative. Like, we love technology. Pretty much everyone on this earth has a cell phone, a smartphone, whether it's Android, iPhone, this app is on there. So let me pull it up for you. You world. Amazing, 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 amazing. Y'all, like I said, if you take nothing else from this video, please take this tip. Number 1 and number 3 are pretty much the most important tips of this video, but let's just continue. So UWorld is an app that you can either download from your phone or you can access from a computer, an iPad, any kind of technical device that you have. You can access UWorld. So it's a question bank. It's not like hers to where it comes with a manual or anything. It's just straight practice questions. They have a few different bundles that you can get. The one that I purchased was the 30-day one. They have 30 days, 60 days, 90 days, so on and so forth. But you only need the 30 days. That's how I feel. That's what I used, so that's what I'm going to promote to you all. But yes, UWorld is a Q bank, and UWorld is a question bank. It has like 1,000+ questions, I believe, and you basically just use them to gauge your knowledge. So what I really liked about UWorld is that every single question that you answer comes with a very detailed rationale. Literally all the rationales were like a paragraph long, and whether you got the question right or wrong, it's imperative to read the rationales, because if you got it right, you need to understand why you got it right. Make sure you actually know the content, and like I mentioned earlier, that you're not memorizing. So if you got it wrong, you absolutely need to understand why you got the question wrong, and just be able to go over that rationale and understand and learn that material. So UWorld is very good for that. The thing that I enjoy most about UWorld is that it looks exactly like the Nclex, okay? Exactly like it. I don't know who made it, I don't know who created this, but you knew what you were doing, okay? It literally looks exactly like the Nclex. The questions are very similar, not similar to where like questions are repeated or anything, but it's just the type of questions that you see on UWorld. Like the structure of the questions is pretty much the structure of the questions that you'll see on Nclex. So when I say UWorld really resembles Nclex, what I mean is that they have the same types of questions. Nclex can throw several different types of questions at you. You have your SATA, S-A-T-A, which stands for select all that apply. You also have hotspot questions. This is where it'll show you like a picture or some kind of graph of some sort, and it'll tell you to click the spot that they're looking for. And it also has the ordered questions, to where you put something in order, whichever order that they tell you to put it in. And this is just very important because it makes you more comfortable with what you'll see on actual test day, which can also reduce test anxiety, and it can just really alleviate some of the added stressors. And I was just on the UWorld app all the time, so when I sat down to take my Nclex, I literally was just like, okay, cool, because I've seen this before. I see this all the time. I'm very familiar with this because it literally, like, aesthetically, it literally looks just like the questions on this app, or the setup looks exactly like the setup on this app. So I love that. Like I said about the rationales were amazing. What I also enjoyed about UWorld is that you can pick the amount of questions that you want. So say if you're having a busy day, you're using another resource, and you just want to test yourself on 5 questions, you can go onto the app, you can select which systems you want to pick. Like say for instance you're really weak in neuro and cardiac, and you just want to test yourself over those. You can go into that app, click neuro and cardio, and click like a 5 or 10 question test, and you'll get 5 to 10 questions just solely based off of those systems to gauge your knowledge. The most questions that you can take at one time on UWorld is 75, and that I really enjoyed because that's the goal. Anybody tells you it wasn't their goal to pass Nclex in 75 questions, they a lie, they lying, and the truth ain't in them, okay? They're lying because that's the goal. So the questions on UWorld, to be quite honest, are very difficult. I won't front with you. They're hard, okay? And that may be intimidating to you at first, but honestly, don't allow it to be. You have to just remind yourself that Nclex is hard. I mean, it's not an easy test. It's not a test that you can just use one book for and study for and be successful. It's a test to where you have to literally pull knowledge from everything that you've come across in nursing, from nursing school to clinicals to after nursing school. You just basically have to put all of that information together to pass this test. Like I said, it is very doable, so don't let that scare you. I just want to warn you that the questions are hard. So one thing I really enjoyed about UWorld was the ability to time yourself. The NCLEX is a timed exam, so you really want to get yourself acclimated and just used to answering questions in a short amount of time. You don't want to allow yourself to get stuck on one question too long. And that's what I really liked about UWorld. So to wrap everything up, tip number 1 was to have a great foundation. Tip number 2 was, if this is something that you can afford, then to go ahead and really use that Hearst information that I gave you. And finally, tip number 3, UWorld, UWorld, UWorld. So this is the end of this video. I hope you all have learned something. If there are any questions that I left unanswered or anything that wasn't clear, feel free to leave me a comment down below and ask any questions that you all have. I am here to help, and you got this. Stay positive. You made it this far for a reason, and that's because you're capable and you know your stuff. So don't doubt yourself. Don't let this test make you question anything about your knowledge. Just use it exactly for what it is, which is to test your readiness. So I hope you all enjoyed this video, and until next time, bye.